We have Becca Leffew with us. So I want to give you just a little bit of background. Becca started her LNC journey a little over a year and a half ago, and she is absolutely thriving. She has done like over 80 cases, and today we are bringing to you the nursing home chronology formula that leads to repeat LNC work. So it's going to be a very good one. It's nothing like we've ever done before. Becca, thank you for being here. I'm so excited
Glad to be here.
to hear this, and I'm going to give you the floor.
Awesome. Thank y'all for joining. Let me go ahead and get started. Yes, today we're talking about the nursing home chronology and just kind of how that works. And so one of the biggest things is, and I'm going to share, I have a few reports that I've redacted and just they each kind of have good key points that we're talking about. But mainly today is just, we're not going to talk about necessarily how to summarize records faster. We're going to talk about how to build a chronology that help solve the attorney's problem so well that they want to keep sending you repeat cases. So one of the biggest things is the difference between a good chronology and a repeat business chronology. It has nothing to do with length of the report. And we'll talk about that a little bit more as well, but it has everything to do with clarity. A lot of times attorneys will say that there's too many records, which is true. So many nursing home cases, we're dealing with not just a nursing home, but we're also dealing with multiple hospitals, we're dealing with EMS records, rehab records, possibly home health records, additional nursing facilities. So there are so many different pieces, so many different records to sort through. That's one of their biggest things is they don't have the time. There's too many records, and there's very little clarity around what happened when it happened. And so that's where our chronology is going to come in. I've had some people do it where they take all of one facility's records and they put it in chronological order. And then they go down to the next section and they have another facility and put it in chronological order. And so essentially you have one timeline up here, another down below, and those timelines can go together, but they've separated it by facility. I would recommend, based on attorney feedback and just for the flow of what you're trying to provide that clarity, is to put everything in order no matter where they were. Definitely some unique challenges just across nursing home cases is you're usually dealing with fragmented records. You've got bits and pieces. Nothing is ever provided in chronological order, in any type of order. And if you receive records for your cases in order, I want to know who you work with because that just doesn't happen. So that's also where the chronology is going to come in place so we can put that information in order, provide that clarity. There's a lot of repetitive charting. Repetitive charting can hide deterioration. If you say over and over, it's getting clear, and all of a sudden it's you can see it's repeated charting over and over. It's just copy and paste. And so that definitely hides when things deteriorate because you'll get a couple weeks down the road and all of a sudden we have a giant wound or we have a fall or an infection. And so when you look at charting, you're like, when did this happen? Because nothing in the nursing assessments show there's any problem. So one of the biggest things to note is you're going to know what happened, but some of our biggest indicators and the important events in these cases are often what didn't happen. So the attorneys will, I've heard from them multiple times, just kind of like they can't tell when things went wrong. The timeline around everything's confusing. They don't necessarily know what's important, what matters. And that's again where we come in our nursing judgment and just being able to recognize those deviations in standard of care, go through those records. And so if an attorney has to work to understand your chronology, they don't come back. A chronology is not a summary. You want to pinpoint the moment when things change. A summary is going to tell you what happened, but a chronology tells me when patterns changed, when the risk increased, when staff failed to respond. And I'll pull my report up here soon, but you'll see that I do have a summary. So my report's kind of a few things together. My chronology is the base of everything that's in my report. Definitely want to just make sure, drive that point home. Your chronology is not a summary. The biggest thing about a chronology is the pattern recognition. Attorneys care mostly about patterns like turning and repositioning, wound care consistency, nutrition and hydration, bathing and hygiene, and fall precautions. One misturn doesn't make a case, a pattern of misturns does. That's the importance of having that pattern recognition, the chronology that lays that out and shows that to the attorney. Before we track the decline in a patient, we want to establish what you can call somewhat of an anchor. So you want to establish their baseline status, their comorbidities, their mobility, their cognition, their skin integrity. That's primarily what I see. But if we're going to talk about wounds developing, it's important. We can't just say this wound developed and go on. We need to know, where did they start? Do they have any comorbidities? Can they move themselves or do they require others? So go into that mobility cognition. Do they remember who they are, where they are? That's important. So many times I'll see turns and it says reminded patient, or patient can turn self, or encourage patient to turn. Well, do they understand that? Can they turn themselves? So that's where that cognition comes into place. Cognition is important for falls. And you can say you educated them on fall risk, but did they understand? Do they have the capacity to understand, or do they have dementia, Alzheimer's, just any kind of, do they have a traumatic brain injury? So there's a lot of different things you want to focus on. You want to know their baseline because that affects other things. Are they a diabetic? A lot of times you'll see people note that wounds are diabetic wounds. How do you determine that? That's where the pattern recognition comes in. Most nursing home cases fall around what we call the four silent dangers, and that is skin breakdown, falls, infection, nutrition, and hydration decline. Call them silent dangers because the decline often happens slowly. And so you're following that change over time. We're going through the charts. We're looking for missed assessments, delayed physician notifications, late intervention, repeated charting, identical charting. We talked a little bit about repeat and identical charting, but that's important. It's important to note you're going to have two different sides of it. You're going to have nursing home cases where you don't have charting, you don't have nursing assessments, you have missed nursing assessments. And that's definitely one thing we're looking for. You're going to have some that you have an assessment every shift. It's perfect almost every shift. And so you're going to see that repeated charting, identical charting. You're going to notice that, yes, at the end of each assessment, every nurse had the call bell and reach, bed in low position, turned Q2. Every one of them said it, they said it identical. You never can go just off a nursing assessment alone. That's a one moment in time versus the MAR and TAR or the CNA records, which can show you more of if those interventions were actually implemented. I'm going to share a visual.
To see Becca's sample report and explore more trainings like this, click the link below to join the National Legal Nurse Consulting Network. Members get access to hundreds of trainings and resources inside. Join the NLNCN today.